As the Jubilee government undertakes to provide free maternity services in the next 100 days, or should I say 99 days, well, health experts and stakeholders are warning that the pledge may not be feasible as some government hospitals cannot meet all their operational costs even as they charge patients currently. One such hospital is the largest maternity facility in the country, that is Pumwani Maternity Hospital, that says it shall not be waiving its maternity charges even if the policy comes into force. Well, Wilkis Nyabo reports on the Jubilee pledge that is noble but may not take off.
President Uhuru Kenyatta was sworn in. Women poured into Pumwani Maternity Hospital, looking forward to free maternity services as promised by the President, a task to be fulfilled in his first 100 days in office.
We will ensure that maternity fees are abolished and that all citizens of Kenya are able to access government dispensaries and health centers free of charge.
Wamekuwa na changamoto nyingine kubwa, napata mwingine ana pesa, amezelea kwa nyumba, mtoto haja survive. Lakini vile hii maoni imetokezea ati unaweza zaa bure kwa maternity, ndio itasaidia wanawake wengi sana.
Every month, at least 2,000 expectant women come to the Pumwani Maternity Hospital to deliver their babies. Of these, about 3% will find that they are unable to raise their delivery fees. The waiver proposed by President Uhuru Kenyatta is expected to provide a reprieve to expectant women all across the country. But shall it? It would later sink in that maternity charges in hospitals such as this one shall remain the same. Every year, Kenya registers 1.5 million live births. At Pumwani Hospital, a woman who has a normal delivery is required to pay 4,600 shillings, while one who undergoes a caesarean section will pay 7,800 shillings. For every night she spends in hospital, she will pay 400 shillings for her bed. Women who undergo caesarean sections are likely to remain in hospital for at least 4 days. The total cost, one that many in low-income areas can hardly afford, yet it is unlikely to fall.
The waiver that the President may be talking about is maybe this 20 shillings. 20 shillings in the health centers. But if you come to Pumwani Hospital, you're usually referred because you have a difficult delivery. Those cases which need operation in theater, a cesarean section, there is a cost implication.
Health centers charge expectant women just 20 shillings to give birth, a fee that was implemented during Charity Ngilu's stint as Minister for Health, and one that shall now be waived. Yet despite the subsidized cost of giving birth in a dispensary or health center, many women bypass them on their way to the bigger and more costly health facilities, citing the fact that while health centers are served by midwives and nurses, hospitals are served by doctors and are better equipped in case complications arise. Begging the question, if maternity services were made free in all facilities, would hospitals see an influx of patients similar to the rush for schools occasioned by the free primary education program? And are the hospitals equipped to handle it? The solution, a section of healthcare analysts now say, is not to give free maternity services, but to improve healthcare services.
Because most of the times, those women will go to deliver in those health facilities, but you'll find that they don't have even gloves, they have to go to buy. They have no syringes, they don't have even the essential basic emergency drugs in case of anything.
It will entail the repair of the existing health facilities, and it will entail the construction of new health facilities,
allowing women to pay a token amount that would go towards maintaining the facilities while ensuring quality maternity services across the country. Wilkis Nyabo, KTN Prime.
Well, for President Uhuru Kenyatta's free medical care pledge to be realized in 100 days, it will all depend on who he chooses to be the Cabinet Secretary for Health, preferably with a background in healthcare. This appointee will have a better understanding on how to implement this ambitious promise than a party loyalist would. KTN's Catherine Omwanto takes a look at the health docket and the health sector's preferred criteria for selecting the person who will take over the ministry from former ministers Professor Anyang' Nyong'o and Beth Bugo.
The shallow breaths of 7-month-old Victor Sempele are a telling sign of his ill health.
Nikajifungua vizuri na nikaliliziwa. Nilipokaa akiwa na miezi 3 akagonjeka pneumonia.
Not only was baby Victor diagnosed with pneumonia, he was also found to have a congenital heart condition known as truncus atreus type 1. Now 35-year-old Ruth, a single mother of 2, must look for 1 million shillings to save her baby's life.
Nikaambiwa Karen Hospital huwa wanasaidia. Nikarudi huko Karen Hospital. Nikaenda wakanipimia mtoto, wakaniambia ni mpaka India.
India, a 10-hour flight away when Kenya is known to have some of the most brilliant medical surgeons in the business. But these brilliant minds are not enough to offer medical solutions to 40 million Kenyans.
It's a no-brainer for me. You have to train the specialists. We have 8 neurosurgeons in the country. What happens to the 100 plus who need neurosurgeons every day? We can't have Dr. Munena and Dr. Ruturi do all the surgeries. We can't have less than 10 cardiac surgeons and expect to sustain 40 million people. It makes no sense.
Lack of medical specialists is just one of the issues plaguing the health sector. Not to mention the lack of facilities and equipment as simple as latex gloves and syringes in many dispensaries and public hospitals.
The families that suffer the poor facilities that we have lived in the dark so much, they don't appreciate that they could actually be light somewhere else. And they blame themselves for a failure that is not their own because they pay their taxes. As long as healthcare has not been a political issue, then the politicians have been very comfortable ignoring it.
The inauguration of Uhuru Kenyatta as president marks a fresh page and an opportunity for the new government to bring health matters to the forefront.
The cost of healthcare in Kenya has not been extremely high. Now, our goal at this stage is to get 15%. But 15% is not realistic in the immediate term. However, even with 10% of the budget, we can do a lot and see a big change from where we are. I think starting with 10% at this stage, you can actually move this country from the dark ages.
Their manifesto on health may be an ambitious one, but is a step in the right direction. However, how well this works out depends on who Uhuru Kenyatta chooses to be his cabinet secretary for health.
You noted that we had a lot of fracas last 2 years as a union with the government. Believe it or not, a lot of this would have been very unnecessary were it not that the understanding of certain cadres of workers in the health sector were better understood. For example, the registrars. And we had an argument that should never have arisen, that should we or should we not pay the registrars? You know, if we had a person with a medical background heading that particular ministry, it should have been an issue because they know how much work they put in and that they're an integral part of that workforce. And therefore, nobody would have hesitated to pay them.
This person should be able to create self-reliance within the healthcare system, even with the current 7% allocation of the national revenue.
We have a program that is largely dependent on donors. Look at our HIV programs, TB programs, malaria programs, 95% dependent on donors. Right now, there's a big fear that the donors may cut down on these funds and leave our helpless patients without any kind of treatment. We don't have a sustainable plan that is locally produced, so we need to begin to work on our own solutions.
This healthcare professional may revive the universal healthcare program and finally implement it to the benefit of Kenyans. Kenyans like baby Victor, whose unemployed mother cannot afford treatment from a private hospital, let alone India.
The NHIF scheme, a universal insurance scheme, I believe it's possible and I believe it's part of our solutions. Why have you opposed it? Many people have given various reasons. Now, one of this is that private insurance companies don't want this to work. Well, all those could be true. But my reason why I do not support what we had last season is you collect money from people for insurance, yet you don't have the facilities to give healthcare.
The chairman of the Kenya Medical Practitioners and Dentists Union says a healthcare professional as cabinet secretary could be the key in keeping doctors and health workers out of the streets and in hospitals and government clinics. However, with 22 cabinet posts to give out and twice as many party loyalists to please, having a healthcare professional to take over the docket could be a pipe dream.
First, I'd be absolutely crestfallen. I've been very optimistic that the change in government would bring about a breath of fresh air to the health sector. What will that mean? I will start all over again what I've done for the last 2 years, which is to try and explain what healthcare is, what are the important issues, what needs to be done.
The previous government focused most of its efforts in improving infrastructure throughout the country. But the Jubilee government seems to have a special place in its heart for healthcare and providing healthcare to all Kenyans, rich or poor. And they also have a very ambitious manifesto. So when the newly installed President Uhuru Kenyatta finally sits down to name his cabinet, it will be interesting to see whether he will bow to political pressure and appoint party loyalists, or whether he will actually appoint a healthcare professional who understands the in and outs of the healthcare sector. Catherine Omwanto, KTN in Nairobi.